All right, so this shouldn't take the whole time for me, which is good because we're starting a little bit late, but welcome. We're going to talk today about food insecurity and food deserts as you guys are enjoying your salsarita, with your full belly. So my goal today is really to, at the end of this lecture, hopefully you're going to be able to define what does it mean to be food insecure? What is a food desert? How is that defined? How does food insecurity compare to hunger? What is the difference between those? And then really want to spend some time thinking about food insecurity nationwide, but also within the city of Louisville and Jefferson County, and then our clinic patient population in the AIM clinic, and talk about what the health outcomes are, what the implications are for chronic medical conditions. And finally, I want to spend some time talking about our food pantry that we have in AIM clinic, and specifically let you guys know what we need from you to make it successful, because we do have some things that we need you guys to be doing in AIM clinic to try to help us expedite getting patients approved for the food pantry. Okay, so what is food insecurity? It's really the limitations from financial resources and social resources to have sustained access to food. So sometimes it means you don't have access to food. Sometimes it's just the worry that you might not have access to food. And that differs from hunger, right? So hunger is that physical sensation, that discomfort that you get when you don't have anything to eat. And certainly hunger can stem from food insecurity, but they're two different things, and just want to make sure that that's clear, that food insecurity is just that lack of ability to obtain food on a regular basis. So what is the scope of the problem? Thankfully, in this country, we have seen a dramatic decrease in the rate of food insecurity over the last decade or so. The most recent numbers that I was able to find from the USDA are from 2018, and nationwide, about 11.5% of Americans are food insecure, which translates to about 1 in 9. But that's still a large population of patients. That's 37.2 million Americans and includes 11 million children. We tend to see food insecurity more often in lower socioeconomic areas. We see it more often in the southeast United States. We also see it in Appalachia. The next set of maps are from Feeding America, and it's 2017 data, so it's not quite the same thing that I just showed you, but the numbers are pretty similar. And as you can see, let me see if my cursor comes up. Southeast United States has a higher amount of food insecurity, Appalachia as well, and then out in the west. So when you zoom in on Kentucky, remember that this again, 2018, the numbers, 11.5% of Americans were food insecure. In 2017, almost 15% of Kentuckians were food insecure. And it probably is no surprise to some that Eastern Kentucky, Appalachia has a higher rate. But here's Jefferson County, and it's a darker green. And here in Jefferson County in 2017, 15.3% of the population was food insecure, which translates to almost 120,000 people. Now, if you compare Louisville to other cities, we're actually not doing terribly. This is older data. This is from 2015. But when you compare Louisville to, say, Memphis or Birmingham or Indianapolis, which is nearby, we're actually doing a little bit better. But we still have a ways to go. So the Community Foundation of Louisville did a survey in 2016, and it was published, I think, the end of 2018, that looked at Louisville Metro and food insecurity and food deserts. Noted that 44,000 people were living in food deserts, which I'm going to define in a minute. And interestingly and kind of sadly, people who lived in neighborhoods where the fewest number of people had cars, there were 0 supermarkets or grocery stores. And we're going to talk about that in a minute. 47% of these patients, this was again in 2016, who were food insecure did not qualify for SNAP. So SNAP, does anybody know what that is? Yeah, food stamps. So almost 50% of people who are food insecure didn't qualify for food stamps. If you've listened to the news recently, you might have heard that the federal government is actually looking at changing the requirements for food stamps to make it even harder. And so that number is going to go up. And 53% of the people from Louisville who answered this survey said that they had had to choose between food and some other expense at least a few times over the course of the year. So let's talk about food deserts. So what is it? Basically, it's just areas where there are no grocery stores, no supermarkets. That's places like Kroger, that's Aldi, that's Walmart, Meijer, any of those. The way that it's defined by the USDA, it's at least a third of the population in a census tract are more than a mile away from a grocery store in urban areas and more than 10 miles away in rural areas. It's studied, but it's the data that I was able to find is a little bit older, but it's still pretty significant. Affects up to 23 million Americans. Over 2 million Americans 10 years ago were living in areas with food deserts and had no car. I think a picture, though, speaks 1,000 words, and so I want to show you some data from Louisville. So this is a map. It's from Louisville Food Ecosystem, and this shows you where the grocery stores are in town. So all the blue shopping cart icons, those are the grocery stores. All of the red X's, those are locations where there were grocery stores until 2016, and there is not anything there now. And this, again, these are it's Kroger, but it's anything that would be a supermarket grocery store. If you can see some of these shaded areas in the darker red, those are areas of higher poverty. So I want to zoom in a little bit. This is, again, downtown Louisville, West End. Look at all these areas that have poverty, and some of these are upwards of 60% of the population is in the poverty range, and there's no grocery stores. There's basically 2 in this whole area. And so a lot of our patients live in food deserts. Can you imagine if you didn't have a car, because most of our patients are coming by 2 or 3 buses to get to clinic. They don't have a car, and they would have to take a bus to a grocery store. Definitely would only be able to carry a couple of bags, I think, just kind of think about that. Okay, so we've talked about food insecurity and defined what that is. We've talked about what food deserts are. So now let's think about our clinic patient population a little bit. So we started screening patients for food insecurity in August when we opened the food pantry. And based on the numbers I calculated last week, about 43% of the patients who had been screened were food insecure. So again, let's review the numbers. In the United States, it was 11.5%. In Kentucky, it was 14.9%. In Jefferson County, it was 15.3%. And in AIM Clinic, it's around 40%. So that just kind of tells you, again, our patient population is disproportionately affected. So this is all well and good, right? But what does this have to do with medicine? So there have been a lot of studies that have looked at food insecurity and have actually been able to show that there are associations between lack of access to food and a lot of chronic medical problems. Patients who are food insecure have a much higher rate of diabetes and obesity. They have worse glycemic control, so they have higher A1Cs. They tend to have more hypertension. They tend to have higher rates of depression and just lack of feelings of self-worth and all of that goes into it. And you might be asking yourself why. If a patient doesn't have access to food, why would they be obese? So I think it goes back to this food insecurity cycle. And so think about it this way. You've got somebody who is food insecure. They're not sure where their next meal is going to come. They have a lot of stress related to that. And so some of the choices they make are going to be to buy cheaper food options, which frankly sometimes is very nutrient poor. So you can go to McDonald's and get a double cheeseburger off the $1 menu. And you can eat that and feel satisfied. You probably can't use $1 at the grocery store and buy something that is going to be as filling. Again, chronic stress, anxiety related to not having enough to eat or being worried about that, tend to eat more carbs, that sort of thing, making those sorts of choices. So then people start to develop obesity. They start to develop diabetes. They develop hypertension. They're eating a lot of salt. And so then they have to see their doctor. They're put on medications. They might be in the hospital with a CHF exacerbation. It kind of cycles through. They may miss work because of doctor's appointments and hospitalizations. They may miss work because they have to take time off because they've got disabilities now. So you've got lower household incomes, you've got higher expenditures on things other than food, which is going to make food insecurity worse. And it just cycles through that way. This is from Feeding America in 2014. They looked and asked patients and people who are food insecure kind of about the tough choices that they have to make. 80% said that they chose inexpensive, unhealthy foods. 66% said that they had to choose between healthcare and food at some point in time. And so think about our patients, right? Sometimes we get frustrated because they don't fill their prescriptions. They're not adherent to their medications. They don't follow up when they're supposed to. It may be that they're having to make these hard decisions. Do I eat or do I pay for this medication? Do I eat or do I come to clinic and pay the copay? I do want to mention food insecurity does not equal poverty. So yes, patients who are living in poverty tend to have much higher rates of food insecurity. However, about a quarter of people who are food insecure do not live in poverty. And so think about all of the people who are living paycheck to paycheck, and probably some of us in this room have had that in college or even now, living paycheck to paycheck. It takes one major expense, one major, car gets totaled, or you need a new roof, or you have some sort of hospitalization and you've got $10,000 in medical bills. It takes that one issue to then take away the money that you would have for food. And so that's how people become food insecure and are not in poverty. Okay, so a lot of doom and gloom. So what do we do about it? How do we help people? So I'm going to talk about our food pantry in the clinic, and then I'm going to talk about some of the other resources that you can share with your patients. So our AIM Clinic Food Pantry, it opened in August. It took 2 years to get this approved by legal, and so we were really excited about it. It is sponsored by Dare to Care. They're the ones providing all of the food. I will be the first to point out, I know that ideally for health, being able to provide patients with fresh fruits and vegetables would be the best. We don't have the ability to do that. This is at least it's a compromise, but it's an option. And so we've got shelf-stable milk, we have oatmeal, rice, whole wheat pasta, we have canned fruits and vegetables that are low salt or low sugar, peanut butter, tuna fish, canned beans. Again, it's better than nothing. It's not ideal, but we're doing the best with what we have. So who can qualify? This is important, and this I think is, if you take nothing away from this today, really want you to take this away so that you can help your patients in AIM Clinic. So 3 things that a patient needs to demonstrate in order to be able to access the food pantry. 1, they have to screen positive for food insecurity. 2, they have to have a medical indication that they need more food. And 3, they have to demonstrate significant or sufficient financial need. This was not something that we wanted. This was the only way that we could get this through and get it open. So again, we're working with what we have. I do want to point out, so that you can tell your patients who qualify, they can come in anytime clinic is open and get food. They don't have to have an appointment with you. They don't have to have an appointment with anyone. They can just come in, go to the front desk. If they're approved and eligible for the food pantry, they can just say, I'm here to get food, and they'll get it for them, no questions asked. Okay, so step 1. Every patient that's coming into AIM Clinic is getting an AAFP social needs screening tool, which is one of the handouts that I gave you guys. And everybody is filling this out, in theory. So this is what it looks like. The one that we have in clinic is not in color, but there are these 2 questions, number 3 and number 4. These are the food insecurity questions. These are actually, it's taken from hunger vital signs. It's been validated in patients. It's got a sufficient sensitivity and specificity to use. So the 2 questions, within the past 12 months, you worried that your food would run out before you got money to buy more. And then the second question, within the past 12 months, the food you bought just didn't last and you didn't have money to get more. So either worry about not having money or actually not having money to get more. If a patient answers often true or sometimes true for either of these questions, it doesn't even have to be both, they screen positive for food insecurity. And so the first thing I need you guys to do, and I know it's a work in progress, I need you to look at these when you, I need you to look at these forms in clinic when you see your patients. The MAs are supposed to give this to you. I know they don't always. So be sure to ask for these forms when you see patients in clinic. That way you can look at this. There are other questions on this screening form too, and Dr. Kubiak had given me some data of 306 forms that she looked at. 172 people commented that they had something other than food insecurity. So difficulties with housing, difficulties paying bills, transportation. There are a lot of things going on with our patients. But please try to look at this form every time you have a patient in AIM clinic. If the patient screens positive, the second part of this is that you have to demonstrate that they have medical need. I'll give you kind of a hint. Pretty much anybody that has a chronic medical condition should qualify. Anybody that needs to be on a prescription medication that they may end up in a position where they're having to decide whether to get their prescription or food. So anybody with depression, anybody with anxiety, anybody with PTSD, any mental health issues, certainly diabetes, hypertension, obesity, but asthma, COPD, rheumatologic issues, hypothyroid, really 95 to 99% of our patients would have some sort of medical indication that additional food would be helpful. So if your patient's screen positive and they have a medical need, which most should, the second thing that we need you to do is to ask your patients about food insecurity. Ask them if they would be interested in potentially accessing the food pantry. And the reason I say that, they may not qualify because of financial means. So don't tell them, oh, you can access the food pantry. But what you should do is say, we have this in our clinic. You may be eligible. Are you interested in us looking into this a little bit more? If they are, I need you to place an order in Allscripts, which I'm going to show you how to do. If they're not, just put a 1 line in your note so that Dr. Kubiak and I, when we're going through these screening forms, will know that they were not interested and we don't bother you. So here's how you do the order. So you go to the referral, refer to food bank, and then link it to medical problems. And so link it to food insecurity, but also if you can, try to link it to one of their chronic medical problems. So type 1 diabetes, food insecurity. And then for this question, the reason for the consult, screen positive for food insecurity. And then there are 2 questions that you have to answer. One is, in response to the hunger vital signs, the patient screened positive for food insecurity. Those are those 2 questions on that screening tool. So if they answered yes, either often true or sometimes true for either, click yes. And then they would derive a medical benefit from access to food, yes. And that's all you have to do. So then the third part is Dr. Kubiak and I have to go back and figure out whether they have financial need to access the food pantry. So how do we do that? Based on what ULP was willing to do, it's basically anyone who lives at the 185th percent or less of the poverty level. So you don't need to know these numbers, but I thought it was kind of eye-opening to see what we're talking about as far as income. For a 4-person family, the the annual income for that family of $47,638. If they're at that or lower, they would be eligible. So it kind of makes sense that there's probably 25% or more of patients who are food insecure but aren't eligible. So how do we evaluate this? So if a patient has Medicaid, WIC, which is the Women, Infant, and Child, that's the providing formula for babies, and so if they've got WIC, if they've got SNAP or food stamps, if they have this temporary assistance for needy families, those are all things that the federal government or the state government has already qualified them for. They would automatically meet our criteria. And so if they have those things, they should qualify, no problem. Otherwise, we have to see some sort of proof of income. So this is where the second sheet comes from, and we'll go through that in a minute. So the third thing I need you guys to do is to inform your patients who want to access the food pantry or interested, tell them what they need to bring with them back to clinic so that we can verify whether they qualify or not. So if they have Medicaid, you're done. So that's passport, but there are other Medicaids. I know it's difficult to figure out what kind of insurance they have. If you're not sure, you can ask your attending in clinic. If they're not sure, just ask them to bring in whatever documentation they can. So that's what that sheet is, the second sheet that I gave you guys. And so this is actually what Dr. Kubiak and I fill out. But if they've got Medicaid, those insurance cards are scanned to the chart, so we're done. If you can figure that out, they could actually access the pantry that day while they're in clinic before they leave. Otherwise, they would need to bring in a copy of their SNAP or their WIC or their temporary assistance for needy families card. They could bring in their pay stub. They could bring in their Social Security benefits letter, recent tax return. It's kind of listed on there, but those are the things you want to tell your patient before they leave clinic. If you want to access the food pantry, these are the things that we need to be able to figure out whether you're eligible. And so I know a lot of you in this room have probably gotten text or tasks from Dr. Kubiak in particular, some from me, because we've been looking through we get all the screening forms, and then we go through, figure out who's food insecure, and then go into their chart and figure out, is there an order for the food pantry? Do they qualify? And probably 75% of the time, you guys just didn't see the screening forms. I know that that's one of the big bottlenecks, is you all are not getting them, but you don't know what to do with them when you do get them. So that's part of why today we wanted to go through it. But we've been tasking the residents to call the patient and find out, are they interested in the food pantry? If they are, here's what you need to bring. And I think it's adding a lot of work. It's adding a lot of work to Dr. Kubiak in particular, but I know it's adding a lot of work to you guys as well, having to call the patients and tell them what to bring. And so if we can try to incorporate this into the process in AIM Clinic, is going to work a lot better. Okay, so that's AIM Clinic, but there are a lot of resources out there that I want to share with you. And I think it's important because you're going to have some patients who are eligible that say, you know what, I don't really think that coming here to clinic is a good option for me to get food. Or B, they don't qualify because they make too much, but they still need food. So Dare to Care's website, you can go, and you can do this while your patient's in clinic. daretocare.org. You click on this green need food. You can type in their address or their zip code, and it'll pull up all the soup kitchens, all the food pantries in their area. You can look for where they work and find it that way. It's got the hours of operation. So I think this is really useful for patients. Obviously, if they are women of childbearing age and they have infants or are pregnant, WIC would be a good option. SNAP, food stamps is important as well. Two more resources I really want to share with you that are, I think, going to be very helpful to our patients, not just for food insecurity, but any needs that they have. Louis Connect is one that shows you a lot of resources. So if you go to louisconnect.com, you get this icon, and basically it provides information about food pantries and meals where they can get food, but also where the shelters are, where they can go during the day. If they're in a housing crisis and need some help, I know a lot of our patients are in situations at times where they need legal help and can't get it. This shows you and directs them to where they can get free legal aid, free healthcare, jobs, and education. So it's a lot of good resources on this website. Metro 211 also has very good resources on its website. This is a little bit harder to show or to see, but it again has similar stuff: healthcare, legal, employment, basic needs, community services, mental health and addictions. And then Neighborhood Navigator is more of a nationwide kind of program, but you can type in your zip code, and again, it pulls up resources in the area. So I think that these are all useful tools to us, especially when we don't have a social worker in clinic. Okay, so in summary, I know that was a lot, but food insecurity is just the lack of financial ability to regularly access enough food to sustain a healthy life. Food deserts are areas where there's no food, there's no grocery stores, no supermarkets. And both food insecurity and food deserts, they exacerbate and lead to chronic medical problems. And we need your help to make things run more smoothly in AIM Clinic. And so again, review the screening forms to see if your patient is screening positive for food insecurity. Ask yourself, do they have a medical condition that would require them to have more food? 99% of the time, it's going to be yes. Tell them that they may be eligible and ask if they're interested. And if they are, put in the order for the food bank. If they're not, just write a quick not interested in your notes so that we know and we can close that out. And then tell them what documentation they would need to bring with them back to clinic. And they don't have to, again, it's not necessarily when they come in for an appointment, but they can just bring it to the front desk and they can give that to Dr. Kubiak. So that's pretty much all I've got. Any questions? Yes.
Hey, sorry. How often do we need to screen these patients? For example, if I've had a patient who screened positive maybe in January, do I need to keep doing the form every time they come for their appointments, or?
That is a great question. So once somebody is screened positive and is eligible for the food pantry, we give them access for 12 months before they have to be rescreened. Every patient, because we don't have a way to really track that very well when they come into triage, every patient is supposed to be getting this form every time. And part of the rationale with that is somebody may not be food insecure at one visit, but they might have had some sort of event that happened that now they are food insecure. And so we want to make sure that we don't miss people who develop food insecurity. But yes, if you've got somebody, and Dr. Kubiak and I are putting a red banner, like when you're looking in all scripts and you see the red banner, it'll say, if they've already qualified and they're eligible, it'll say eligible for AIM Clinic Food Bank, and it'll have the dates. And so you'll know if you see that, you don't need to worry about the screening form, but if you don't see that, then go ahead and do it. That's a great question. Yes?
Some great resources for the under social needs. And while those websites work great for us, what can we do for patients? Except if they don't have access
Yeah.
to
We have been talking to Dare to Care to see if there's something that we can give them for food insecurity. I think part of the problem is all of the websites, they're because you can look for certain zip codes, it's harder to put like a packet together because it's not going to be as pertinent to that person. And so I don't have a great answer for that. I think it's something that we've talked about, can we identify a computer in clinic that we can access, or we can have them access to pull up that information? We haven't figured that out yet. But that's a good point, that a lot of our patients don't have access to smartphones. They don't have access to the internet. And so if you have time and you can do that for them and print it off, that would be the best. But we are working with Dare to Care to try to come up with some sort of informational packet that we can use to give. But Dare to Care is really trying to push people to use this website, which again is great when you have access, but if you don't have access to the internet, what are you supposed to do? Anything else? We really appreciate everybody's help because I think the numbers are not huge because we don't take care of thousands and hundreds of thousands of patients, but those that have been able to access it in the last few months have been very appreciative and thankful. And we are going to study this over time. If anybody's interested in doing some research in food insecurity and kind of the outcomes for our patients, that's something that we're starting to do. But I think that hopefully we're going to be able to make a difference for people. So, all right. Thank you. And I will make sure that to email out those links so that you have it in your email for Louis Connect and Dare to Care. At least that way you'll have access to it. All right. Thank you.